Dr. Karishma Kirti, a consultant breast specialist and oncoplastic surgeon, and a proud alumnus of D.Y. Patil University School of Medicine. I'm glad to be a part of MediTalks Season 2, organized by MediEscape Community and D.Y. Patil Alumni Association. Today we'll be talking about some quick facts about breast cancer and bust some myths surrounding the disease.
I cannot get breast cancer. I'm too young to get it.
Well, actually, breast cancer is a disease that's related to age. However, because the Indian population is so young, we have a lot of people who are younger than 50 years of age. So, the average age of getting breast cancer in India is 46 to 48 years of age, while as this median age of diagnosis is around 62 to 64 in the Western countries. So, although you are more likely to get breast cancer if you're older, it is not impossible and you're not immune to getting breast cancer if you're young.
I'm not likely to develop breast cancer as it does not run in my family.
Well, actually, breast cancer, which is related to family, is only 5 to 10% of all the breast cancer that is diagnosed worldwide. So, if you have a familial history of breast cancer and multiple people have breast or even ovarian cancer in your family, you may be at a higher risk of getting it, but just because the family history does not exist doesn't mean that you can't ever have breast cancer. Understand that 90 to 95% of breast cancers are in patients or women who do not have any history of breast cancer in the family.
If I find a lump in my breast, it definitely is cancer.
8 to 10 out of all breast lumps are benign diseases, which means they are not cancer and they might never turn out to be cancer also. But having said that, it is important that if you develop a new breast symptom, such as a breast lump, you should get it investigated. And it doesn't matter whether you are male, female, young, old, any new symptom in the breast must always be checked out, and you should be sure that there is no cancer lurking there.
Using antiperspirants or deodorants can cause breast cancer.
This is not true at all. There is no evidence linking deodorants and antiperspirants to breast cancer, and it is just one of those media hyped facts that have been very prevalent, but there is no truth to it at all.
Women using underwire bra are more prone to developing breast cancer.
And this is a baseless fact. There is no evidence linking bras of any kind to breast cancer. You shouldn't wear a bra if you don't want to, but don't stop wearing a bra just because you think it is associated to breast cancer, because this is not true at all.
Then men cannot develop breast cancer.
1 in 100 of all diagnosed breast cancers are seen in males. So although breast cancer is rare in male patients, it is not unheard of. And in male breast cancers, we have to note that they are more associated with breast and ovarian cancer syndromes. So if you have a family history, a strong family history of breast and ovarian cancers, then the males in that family may also be at an increased risk of developing breast cancer.
Radiations from mammograms, x-rays, and other radiological investigations can cause cancer.
A small amount of radiation from a mammogram or an x-ray does not lead to breast cancer. Moreover, having a mammogram every 2 years in women more than 50 years of age can lead to an early diagnosis of breast cancer and better prognosis as the disease is caught early.
From what age should one start screening oneself for breast cancer?
Mammogram for screening is recommended once every 2 years, starting at the age of 50 and up to the age of 75. If you are at a slightly higher risk, this can be discussed with the patient and the doctor, and you may choose to start a mammogram slightly earlier, which is at the age of 40 years.
What are the early signs and symptoms of breast cancer that one should be aware of?
It is extremely important to know what are the symptoms one should look out for. So within the breast, you may have a lump, which is obvious. Other than that, there may be some skin changes. For example, an orange peel-like appearance of skin, pulling in or retraction of the skin, or even stretching of the skin with some dilated veins, or ulceration or a wound that is formed on the skin and is not healing. Other things that are important are the nipple changes, for example, pulling in of the nipple or any nipple discharge, especially a blood-stained nipple discharge may be an ominous sign. Another thing that's important are regional areas, which is your armpit or the root of your neck, and you may have some lumps which you may feel them first before you see any breast changes. That can happen very occasionally.
I found a lump in my breast. What happens next?
If you find a lump or any symptom in your breast, you must see a healthcare practitioner. It is always advisable to see a breast specialist, an oncologist, or a surgeon for any breast lump. when a patient comes to the clinic with a breast symptom, we do something that is known as a triple assessment, in which the patient is examined by the doctor. An imaging modality such as an ultrasound or a mammogram based on your age is done, following which, if we still think that there's something suspicious, then a biopsy may be advised. This is known as triple test, which consists of clinical breast examination, imaging, and biopsy.
Can you tell us a few points to keep in mind for preventing breast cancer?
So, risk factors for breast cancer can be divided into non-modifiable and modifiable risk factors. I won't discuss non-modifiable because of the simple reason that there's nothing you can do about them, such as increasing age or female genders. They put you at a higher propensity for developing breast cancer. So, let's talk about the modifiable risk factors for breast cancer, what you can do to reduce your breast cancer risk. First and most important is exercising at least 2.5 to 3 hours every week. The other thing you can do is have a healthy diet which is rich in fiber. Another thing which is important is avoiding alcohol and smoking. Hormonal factors that affect breast cancer are also very important. So, if you're taking oral contraceptive pills or especially combined hormonal replacement therapy for postmenopausal symptoms, you shouldn't take them for a long period of time and try to restrict them for less than a year. Another thing which is based on your personal preference is your age at your first childbirth. Try to have a child early in your lifetime, and also breastfeeding for up to a year is very important for reducing your risk of breast cancer.
What are BRCA genes?
So BRCA genes are literally breast cancer genes, and these genes, which are BRCA1 and BRCA2, put you at a higher risk of developing breast cancer and some other related cancers like ovarian cancers, and in some cases pancreatic, prostate and bowel cancers. Not everyone with breast cancer needs to be tested for a BRCA gene mutation. However, if you have a history of breast cancer at a young age, less than 40, triple negative breast cancers, multiple breast cancers or tumors you have, or many people in your family have cancers, then your doctor may refer you to a cancer genetic clinic and ask you to undergo genetic testing for the same.
Is complete removal of the breast, also known as mastectomy, the only treatment modality available?
So breast cancer surgery has improved by leaps and bounds from the radical mastectomy, which included removal of all breast tissue along with skin, muscles, and all the regional lymph nodes were also removed. Now we can do breast conservation surgery, which should include the removal of the breast lump with a surrounding healthy margin, along with removal of some lymph nodes from the axilla. And this should always be followed by radiotherapy, and the results for this are comparable to a mastectomy. In fact, there is now some emerging data that tells us that for early breast cancers, breast conservation therapy may be better than mastectomy because we always use radiation with the same.
So, as a breast specialist, what would be your advice for all the viewers?
I think it's very important that we understand that breast health is very, very important, and breast cancer is one of the cancers which is increasing as India is getting more westernized and urbanization is happening. So, I would say decrease your breast cancer risk by having a healthy diet, exercising regularly, avoiding alcohol and smoking. Other than that, I would say please examine your breasts every month, learn what are the symptoms that could suggest breast cancer, and learn how to find them. If you do find something in your breast, don't hesitate to approach a doctor. 8 out of 10 times it's going to be nothing, but you should always be sure and rule out breast cancer. And if it is breast cancer, understand that early disease is very, very curable now, and early diagnosis is key to a better prognosis.